Hi, this is Alexis,
I'm Jillian.
and we are going to be talking about the urinary system today. So, the main functions of the urinary system include eliminating waste from our bodies, balancing the body's fluids in its intake and outtake, regulating blood volume and blood pressure, and releasing hormones to help control the blood pressure and red blood cell production, as well as controlling levels of electrolytes and metabolites.
And then the primary organs of this system include our two kidneys, our two ureters, the urinary bladder, and then the urethra, which you can see in these two visuals. So first, our kidneys. So if you think of like a kidney bean, they're structured sort of like that. And then they are located along our posterior abdominal wall on each side of the vertebral column. They're protected by our ribs and adipose capsule, and they are suspended. And so then the functions include fluid regulation and waste filtration. And you can see in that zoom in where the hilum is, the vessels and nerves and ureter connect to that surface of the hilum. And then as far as filtration of the blood goes, the blood that needs to be filtered is going to be transported to the kidney by the renal artery. And then the filtered blood leaves the kidney through the renal vein. And just a couple little facts, our kidneys filter our blood about 40 times a day. And there are over 1 million tiny filters inside our kidneys, which are called nephrons, and they remove the waste. And they're found, if you look at the bigger picture, kind of in the cortex and medulla. And then by regulating our fluids and filtering our blood, the kidneys help maintain a stable internal environment. Okay, next we have the ureters. They are fibromuscular tubes, and each of them begin at our renal pelvis. They move our urine towards the bladder through initiating peristaltic waves, which is just a contraction and relaxation of the muscles. So that's kind of how the urine moves downward. And if you look the lower right, there's a close-up of what the muscular layers look like, and then how the waves, like the larger part is the contraction, and then the smaller part, or I'm sorry, the larger part is the relaxation, and the smaller part's the contraction.
Well, I'm going to talk about the urinary bladder. It is a hollow muscular organ that helps store urine, and the smooth muscle on the outside surrounding the bladder is called the destrutor. And then on the interior wall is the rugae, and I'm not 100% sure how to pronounce it properly, but is the interior lining of the bladder that helps expand and hold more urine. And then we also have the sphincter muscles that contract and relax, allowing the urine to be held in the bladder and to be released into the urethra. And again, the main function of the bladder is to store urine, and it allows the urination to be more infrequent and controlled. And the normal capacity for the urinary bladder is between 400 to 600 milliliters of liquid. And then next we have the urethra, which is a tube of smooth muscle with a mucosal lining. And in men, it is usually a lot longer than women, since we have the penis to take into consideration, and women do not have one. So it is much shorter. It's only about inch and a half, and for men it's usually about 8 inches. And for men, it passes through 3 regions in order to pass out of the body. The first one is the prostate gland, and then moves to the membranous urethra right here, and then exits out of the penis through the spongy urethra. And then in women, it is just that short area where you have the urethra and then the opening through the meatus. And its main function is just to carry urine from the urinary bladder to the outside of the body.
And here we have kind of the process of how urine is formed. I thought this was like a pretty simplified version since it's pretty complex, but the 3 major steps include the glomerular filtration and the tubular reabsorption, and finally the tubular secretion.
So I found just this quick, cute little video that kind of ties everything together, showing the pathway of urine outside the body. Play it really quick.
Hello there, Nerb.
Chloe, what are you doing up there?
Looking for a learning adventure.
Okay, good luck. Hope you find a good one.
Oh, I already have. Tell me, Nerb, what do you know about the urinary system?
Way too much.
No, seriously, what do you know?
There's some bean-shaped things and maybe some tubes.
Precisely, and also imprecisely. You see, the urinary tract begins at the kidneys, which are the 2 bean-shaped things. The kidneys are organs the size of your fist that sit under your ribs along your back. Kidneys filter blood to remove waste. That waste and extra water combine to make urine, which is also called pee.
Chloe.
After the kidneys, it's pretty much just plumbing. The urine enters 2 small tubes, one coming from each kidney.
Chloe.
Those are called the ureters. They lead to the bladder. The bladder is a sac that holds the pee.
Chloe.
Right now, your bladder is probably feeling very full, since you look really stressed out about it. When it's time to go to the bathroom, the smooth muscle of the bladder contracts to push pee into another tube called the urethra, which carries the pee out of the body.
Chloe, you know that typically I'd love to learn anything about the human body. But right now, I think I'd really prefer to talk about anything but pee.
Oh, I'm sorry, Nerb. I didn't mean to make you uncomfortable.
Yeah, so I thought that was just a funny way to visualize everything and put it all together. Oh no. All right, so next I'll talk about some common disorders. First off are bladder infections, which is also known as cystitis, that are usually caused by bacteria. An enlarged prostate in men, which can make it difficult for them to empty their bladders. Incontinence, when your urine leaks out of the urethra uncontrollably. And kidney infections, when a bladder infection, it kind of backed up into the ureter tubes. And kidney stones, which are caused by infections and high blood levels of calcium. And urinary tract infections, which is an infection in any part of the urinary system, but is most commonly seen in the lower urinary tract and most commonly seen in the bladder and the urethra. And women are at a greater risk than men due to the shorter length of the urethra. And common symptoms among most of these disorders include pelvic cramping, or abdominal cramping, your back pain, some fever and chills, and pain during urination.
And then we have just a way for you to kind of apply what we went over, little quiz. I know that's a good way for me to practice information. So if you want to just like pause on each of these slides and test your knowledge.
And then we also have the, oh, sorry, go
Yeah.
ahead.
I was just gonna say, yep, here's all the answers to those.
And last, we have some more fun facts. The average adult eliminates about 27 to 68 fluid ounces, which is about 2,000 milliliters per day, based on the typical daily intake of 68 ounces of water. Beverages such as coffee and alcohol can increase urination. And if one of the kidneys fail to function and has to be removed, the other kidney is able to increase by about 50% within 2 months and is able to handle the entire task of filtration all by itself, which is pretty awesome. And lastly, the kidney can clean more than 1 million gallons of water in a lifetime, which is enough to fill a small lake. And I just thought this picture was kind of funny about the kidneys. Just thought I'd add that in. And these are our sources.
We hope you enjoyed learning about the urinary system.
Yeah.